Welcome to More Than Words, a podcast about treating the whole child brought to you by the Reading and Language Learning Center. I'm your host, Tristan, and today I'm joined by licensed clinical psychologist Dr. Leslie Hawkins to discuss ADHD and dyslexia. Hi, Dr. Hawkins, how are you?
Hi, good morning. I'm good. How are you?
I'm good. We're excited to have you here. Someone who's right down the way from us. We're very excited about that.
Well, I'm very excited to be here, so thank you for having me.
Of course. So let's start with an introduction. Tell us a little bit about what you do and who you are.
Yeah, so like you said, I'm Dr. Leslie Hawkins. I am a licensed clinical psychologist. I have been practicing for about 15 years now, and I, throughout my career, have done kind of a combination of therapy and psychological assessments. For the last 6 or 7 years, it has been primarily psychological assessments
Okay.
that I have been completing.
Yeah.
So I see children, adolescents, and adults for psychological evaluations. We work with kids that have attention issues, learning issues, emotional and behavioral concerns,
Hmm.
social development concerns as well. So we, provide comprehensive assessments to help with diagnosing and to provide, a treatment plan. So
Yeah.
we see a lot of kids with, of course, ADHD and dyslexia, which is why we're
Right.
here.
Yeah.
But as well as, dysgraphia and other learning disorders, anxiety, depression, things like that.
Yeah. Awesome. And so who are you with folks or you have your own practice?
Yeah, so I work with a group practice. It is a private practice, but like you said, right down the road from you all.
Yeah.
I work with Mindwell Psychology, which is in Chantilly, Virginia.
Okay, cool. And so if people wanted to reach you, Dr. Hawkins, how would they do that?
They are more than welcome they can always send me an email directly.
Perfect.
It is Dr. Hawkins, Hawkins at mindwell.us. Of course, they can also call the office, and the website for the practice is mindwell.us.
Okay. Very cool. Well, I can put that in the show notes so folks can find you. Awesome. Well, let's hop into our discussion of the day. So we're talking about ADHD and dyslexia and how they are often comorbid or if they're comorbid or any of those things. So can you define for us first what comorbid even means?
Yes, of course.
Yeah.
That's a great question. And it's actually, pretty straightforward. I mean, comorbid really just means the simultaneous presence of two or more disorders or medical conditions in one person.
Okay.
If you have two or more, diagnoses at one time, that would be considered a comorbidity. ADHD is a pretty common, kind of neurodevelopmental disorder in childhood, but they frequently do have comorbid learning difficulties.
Right.
And ADHD and dyslexia are one of those pretty common comorbidities. So
Okay.
the rate itself is, 25 to 40%
Oh,
of kids
wow.
one, yeah, are diagnosed with another. So it's pretty high, which is why
Oh
we're
my
here.
gosh. Yes, it is. I think working at our LLC, I think I knew that it was pretty high, but I didn't know it was that high.
Yeah. Of
Wow.
course, it
Okay.
depends on what study you're looking at, but
Right.
that is sort of the range that is given. So, and it is bi-directional. So, what that all means is just it doesn't have to be someone with ADHD is more likely to have dyslexia. It's vice versa.
Mhm.
If you have dyslexia, you're also, have an increased chance of being diagnosed with ADHD as well. So yes,
Interesting.
occur together a lot.
Okay. Wow. Okay. And do you know, does anyone know why those two things are often comorbid with each other?
For a clear, definitive reason of why, no.
Right?
uh, There's a lot of research, of course, being done trying to figure out the reasons for that.
Yeah.
And, there are definitely some theories. You all may be aware ADHD and dyslexia, they both have a strong hereditary component.
Right.
So, what that means is, if you have a parent with ADHD or dyslexia, you as a child are more likely to have one of those disorders, one of those conditions.
Right.
So, the assumption is the same, as far as that comorbidity.
Right.
So, it does tend to run in families. And, this has been something that's been shown time and time again. There are a lot of different twin studies and research that can link
Okay.
kind of that hereditary factor. So, that is also assumed, of course, for both conditions. Um, Another thing that researchers are kind of looking at is to see if there is, along with that hereditary component, if there is any sort of genetic overlap, so any sort of
Hmm.
shared genes that might occur in, both ADHD and dyslexia, trying to
Right.
see why those two would be so frequently together.
Right.
And, you can see that there is a lot of overlap in terms of different genes that are important for things like attention and learning, across the two. But again, there is no clear understanding as far as a direct, correlation and
Right.
direct relationship. Um, a lot of what the other areas that have been focused on is trying to see if there's any sort of neurological mechanisms that are shared.
Okay.
So this would be different, brain structures, that
Right.
are involved, maybe that are occur with ADHD and with dyslexia.
Okay.
And there's a little bit of overlap, but not a lot. So
Okay.
they actually are more different when it comes to
Oh,
neurological mechanisms than similar. I know, right?
that's
They're more
crazy.
different. But I mean, there have been, so there's a part of the brain, the basal ganglia, that's really involved in a lot of complex learning, decision making, and, different executive functions like memory, kind of learning, acquiring learning, learning
Okay.
feedback. And, there is a little bit of overlap where you can see, some activation as far as the basal ganglia is kind of involved in both diagnoses, but
Okay.
there is more where it is different. So
Right.
ADHD is largely kind of in the frontal lobe, more of that, prefrontal cortex, which is involved in all of those different executive functions that we hear so
Right.
often for ADHD. And, dyslexia is different. You have a
Right.
lot of it is located with the temporal lobe, which is related to processing all the different sounds of the language.
Mm,
So kind of that auditory route to reading. And then you have the occipital lobe, which is more related to that visual route of reading, being able to identify those patterns on the page and your letters and sight
right.
words, things like that. So even though there is a large amount of overlap, it still is pretty unclear as to why it
Why?
occurs, what the definitive answer would be related to that, unfortunately.
Wow.
Yeah.
No, I mean, that's so interesting. And I appreciate the talking of the brain, which, I think sometimes we don't get into that. We don't always get into that nitty-gritty. And so I think that was really helpful. I feel like research in terms of the way research goes it's like
Yeah.
pretty young,
Yes.
right?
Yes. It absolutely is. I mean, it's with each new study, they are learning something different and ruling something out. And so that
Yeah.
I think tends to open up more questions until we can replicate, the
Yeah.
same results. But that's where I would say, kind of the strongest evidence to support a reason why would really fall along those hereditary,
Yeah.
factor that, it does run in families. And, there is a strong, kind of genetic overlap. And so that is likely something that is more of the cause. But again, we
Right.
we don't know for sure.
Right. Um, So when we're talking about this comorbidity, what exactly are the signs of it as opposed to like the signs of dyslexia and ADHD? I mean, maybe they're similar, so I don't know.
There are a lot of similarities, which can make it very confusing and complex, I think, for a lot of, parents and
Yeah.
teachers to, kind of determine, what is happening with their child as it relates to learning.
Yeah.
And so before I get into kind of the signs and the similarities between the two, I did just want to give kind of a little bit of an overview of what
Yeah,
each is.
absolutely.
Brief.
Yeah.
But, I mean, I'm sure your listeners here understand, of course, dyslexia. I mean, it
Right.
primarily affects reading
Yeah.
and language processing. So, the hallmark of dyslexia is those challenges, of course, with reading accuracy, so being able to sound out words correctly, to recognize their letters or their sight words. It definitely affects someone's pace of reading. So
Right.
if you're having a hard time with reading the words correctly, you usually are struggling with reading at a pace that would be expected for your age. Not a speed reader,
Right.
but what would be typical for someone's age. Which of course then can affect comprehension. If you're
Right.
spending so much time reading the words, then, typically you're not able to really devote enough, brain energy, that mental space to really just trying to understand and take in what you're reading.
Right.
And, I mentioned it's not just reading, it's language based. So it also does affect writing, spelling, grammar, punctuation,
Yeah.
handwriting can be impacted. So dyslexia is, primarily related to that reading and language processing, where ADHD on the other side, of course, affects somebody's attention.
Right.
There are a lot of struggles with inattention is another, hallmark of the diagnosis. But there's also the hyperactivity and impulsivity side as well. So I like to think about it as challenges with regulation.
Yeah.
So kids with ADHD, they really do have a hard time being able to regulate their focus and, their ability to organize information. They may be more forgetful or misplace things. They may have a hard time regulating their behaviors or
Mm.
their emotions. So they may act without thinking. And, that kind of goes into that more impulsive side.
Right.
In the classroom, they might have a hard time, sitting still. So, the
Mm.
child that is more wiggly and, or may get out of their seat, when they're not supposed to, or
Right.
might share one of their ideas with a teacher when without raising their hand.
Yeah.
So the biggest thing here too for ADHD is that it is more global. So those challenges with their attention, with the, hyperactivity and impulsivity, they occur across multiple settings. So it isn't just when they are trying to complete, an academic task, for example.
Right.
Um, Whereas with, dyslexia, of course, you see primarily these challenges related to, you know, a lot of their academic work. It's not
Yeah.
the only area, but, that you're talking about a learning disorder related to
Right.
language, and that's where you tend to see it. So, of course, these are the main differences, right?
Right.
um, Back to your question of, what are the signs that you might have both? Well, so I'm talking about things that are the hallmark of one versus another, except children with dyslexia can also struggle with inattention.
Mm.
Um, Children with ADHD can also have reading and writing challenges. um, so that does make it very, very confusing. So let's go back to the inattention for a minute.
Sure.
And kids with dyslexia, if you think about how difficult a reading or writing task is, their brain is working extra hard, right, to
Right.
try to figure out, what the information is that they're looking at on the paper,
Yeah.
or they're trying to figure out how to translate their idea, their thought onto the paper in a written format. Their
Yeah.
brain is working very, very hard to do
Yeah.
that. I'm sure you see that at our
Yeah.
LLC all the time. They get tired.
Yeah.
It takes a lot of effort and energy, just mental effort to do that. And it's something that does cause a lot of fatigue, which can really look like inattention.
Mm,
It can also, I mean, if we're tired, we have a harder time paying attention in general. I mean, this goes
right.
for everyone. So when you think about, kids with dyslexia, they can definitely seem like they do have more challenges with focus
Mm,
because they are just simply tired, and they are
right.
having a harder time, paying attention. They may also in the classroom appear to be kind of visibly similar to a child with ADHD. So again, they're tired, they're having a hard time processing language. So
Right.
they may have a hard time keeping up with instruction as well. So
Okay.
they appear like they're tuned out, that they're
Right.
just not focused because they're having a hard time processing all the sounds of the language and, understanding and being able to follow along again at that pace that we
Right.
would expect. They're having a very hard time with it. So they can look tuned out. They might look like they're off task, but really they are experiencing just a greater cognitive load, right? They're
Right.
experiencing it's a greater struggle to be able
Yeah.
to do all those tasks. And so it is taxing them much more. Whereas again, I mentioned, that a child with just ADHD, they do have trouble with focus, but it's something where you're going to see that across multiple settings. Someone with dyslexia, it could be more apparent in the classroom, and that can
Right.
make it confusing, for parents and teachers to kind of understand, well, what am I seeing?
Yeah.
What am I looking at? I know they're poor children that are
Yeah.
trying to figure this out.
Yeah.
They're working so hard. But yes, the inattention is part of it. And, I mentioned kind of the reading challenges also exist for kids with ADHD.
Yeah.
It's not just kids with dyslexia, but, you have children with ADHD that maybe they are guessing words because they are having a hard time, regulating some of those impulses. So,
Mm, mhm.
let's say the reading material is something that they're not as interested in. It would be a
Right.
non-preferred task, which is, again, one of those hallmark symptoms of ADHD is that those non-preferred tasks are much more difficult to focus on and
Right.
participate in. So, if the reading material, let's say, is something that they're not as engaged with, then you may find a child almost trying to read quickly or more impulsively just to be finished with the task.
Okay.
And that could lead to guessing words. So they're not putting as much attention to detail,
Right.
into what the words are on the page. They could just be guessing to kind of move through quickly.
Yeah.
Um, they may also skip over words in that same respect, where they are just trying to kind of move through it and be finished with it.
Right.
And you may see other things too that you see in kids with dyslexia where they might, drop an ending of a word again
Mm,
because they are just kind of going through impulsively.
right.
So you can have those problems with reading accuracy for someone with ADHD as well.
Okay.
You can also have problems though with reading comprehension too,
Mhm.
which if you think about that, it makes sense. So if
Yeah.
someone is having a hard time paying attention, they're having a hard time
Right.
focusing, then they're not able to put as much effort onto, attending to the information in front of them and storing it in their memory.
Yeah.
Um, Kids with ADHD, they do tend to have a weaker working memory, which all working memory is. It's really your short term kind of active memory. So
Okay.
it's what you can hold in, the kind of immediate time frame to be able to then
Okay.
use kind of later on to answer a question or solve a problem. So with reading, you need to be able to hold that information you've already read into
Yeah.
your, working memory so that when you get later on in the story, you can follow along. You can remember what you've already read. You can link that earlier information to the text
Right.
that you're currently reading. And kids with ADHD, they have a hard time with that. They can't hold as
Right.
much information in their short-term active memory.
Yeah.
That can also create some reading comprehension problems.
Right. Of course.
Yeah. And writing is usually a struggle for both, like I mentioned. So, of course, kids with dyslexia, they have a hard time with spelling and, they can have a hard time with punctuation,
Yeah.
inserting that correctly. A lot of challenges with dyslexia is symbol recognition. So they have
Hmm.
time with recognizing not just their letters and numbers, but there can be some challenges with, punctuation symbols as well, and
Wow.
understanding where those go in the sentence
Right.
and what they mean and represent. It's a lot of information to try to learn,
Yeah.
but you can also see, with writing problems with capitalization. A
Okay.
lot of times kids with dyslexia, they have a hard time, again, being able to identify those letters that they see, like the B's,
Right.
D's, P's, and Q's, lowercase. So
Yeah.
you can see a lot of random capital letters, within someone's sentence, a capital B, a capital
Yeah.
D, because they don't remember, which one they're supposed to use for a
To
lowercase,
use.
they'll capitalize.
Yeah.
But that can look like also just problems proofreading, which kids with ADHD have problems proofreading their writing and editing their writing.
Yeah.
So they can make similar mistakes, but it's
Wow.
more related to attention to detail. And, of course, have more trouble organizing their writing and, being able to, again, get their thoughts on the page.
Yeah.
Um, Working memory can really get in the way there too for kids with
Yeah.
ADHD. When they're writing, they might forget what they wanted to write along the way.
Oh
So you can
gosh.
have
Yeah.
sentences that seem incomplete or seem just disfluent or disjointed, that they don't
Yeah.
connect as well to the next thought. Um, but again, if you're looking at someone's writing, it's hard to tell just with the, output that they have on the page. It's hard to tell. Is this because of, inattention and impulsivity, or is this because
Right.
there's an underlying, language processing issue?
Right.
It's very difficult to tell.
Yeah.
I would say one of the other bigger signs of the comorbidity too is just that those challenges for both with initiating, tasks like reading and writing, being able to complete those tasks, or just avoidance overall of tasks that are more, I wouldn't say academic based, but it is for children. A lot of it is in school. So more of those kind of reading and writing tasks that they are, being required to do. For both, you're going to see a lot of avoidance of those
Right.
tasks or challenges getting started because, it's either going to be something that's not preferred or it's something that's hard. And,
Yeah.
kids know it's going to take a lot of effort, a lot of work. And that's where for both, you can see kind of that pushback
Right.
of being able to just complete those tasks. So,
Yeah.
you know, there are definitely differences, but there are a lot of similarities between the
Right.
two that, again, can make it kind of difficult to figure out, is this one, is this both?
Yeah, for sure.
Mhm.
So, is there anything like I know we mentioned reading and writing specifically because of dyslexia, obviously, but I'm trying to think, is there anything that you would say is like a different symptom, like something that you're gonna see in one and not the other? It just is that possible?
Absolutely.
Okay.
So for I think I mentioned a little bit about this earlier, but for ADHD, I think the biggest difference is going to be those challenges with attention, with, the impulsivity,
Hmm.
hyperactivity. those are going to be things that you are going to see across situations. So it is not going to occur just at school,
Right.
or, just when you're trying to do a reading or writing or math task, whatever would be
Right.
non-preferred.
Right.
um, it's going to happen at home as well, where let's say you have kids that have a hard time with completing chores. Maybe
Okay.
parents have given them, two or three things to do around the house. Let's say it could be simple things such as, when you get home from school, make sure you put your shoes in the closet and hang your jacket up and bring your lunchbox upstairs. Well,
Right.
that's things to do. And a child with ADHD, depending on their age, can really struggle with remembering and getting all three of those things done without a lot of reminders or assistance, from
Right.
parents. And you'll notice, those challenges with sitting still or, kind of those interruptions because they like to share their thoughts and,
Right.
you know, without waiting for that turn taking in conversation. You'll see those things at the dinner table.
Okay.
You may notice it in sports as well.
Right.
A child with ADHD may be the one that has a hard time, again, listening to the coach's instructions or being able to plan ahead.
Right.
As kids get older, let's think that kind of middle school, definitely high school age, you're trying to develop the ability to manage time and manage their
Right.
schedule. And again, I say plan ahead, but it's this idea of, being able to get out the door and have everything you need for the day.
Right.
Well, that is something that is going to be a challenge for someone with ADHD.
Sure.
Whereas a child with dyslexia, really outside of those, kind of reading and language based tasks, you don't really see as many struggles with attention, with being able to do multi step tasks,
Okay.
and being able to follow instructions.
Right.
Those differences are, or those challenges are not there in the same manner. Something that there is a little bit of overlap in terms of executive functions.
Hmm.
Both kids and adults with ADHD and dyslexia, they do have usually some working memory deficits. So
Okay.
that is an area where you might see a little bit of what can look like forgetfulness in a child with dyslexia, because
Right.
again, working memory affects how much information you can kind of hold in the short term,
Yeah.
um, which is really tied to learning, which is why you see that together a lot.
Yeah.
But they can have, some challenges with more multi-step, but instructions, but overall, you don't see those troubles with just that cognitive regulation or behavior regulation,
Okay.
outside of more of an academic setting.
Right.
So that would be kind of the biggest difference between the two. ADHD is
Okay.
more global. For
Right.
dyslexia, this is really going to be tied to, reading and writing tasks.
Gotcha. Okay. Yeah, that definitely makes sense. I'm sure for parents though, it's just so hard to like, I'm not a parent, so that's why I'm saying like for parents in general, but I can't imagine trying to decipher between those two things, um, knowing that they are like often comorbid as well. I can't imagine it.
It is very tricky. And
Yeah.
that's why a parent would come see someone like me
Right.
to be able to help
Exactly.
them figure that out. Which,
Yeah.
of course, we can talk about this more later, but that is really the benefit of a comprehensive psychological assessment, is that we can, do a deep dive into a child's attentional abilities, their executive
Yeah.
functioning abilities, but also then looking at, for reading, their ability to process phonological information. I mean, that is a key indicator of, someone that may be struggling with a learning disorder like dyslexia. If
Right.
they're having a hard time, processing the phonological information. So all the sounds of the language, the sound structure, and understanding how it all blends together and break apart. That really is the benefit of doing an assessment with a professional, is to be able to determine, where
Right.
these challenges, what the underlying cause of these challenges is.
Right.
And, it could be something where it is one diagnosis versus the other, but it could be both. And that is really the value of, coming for a psychological assessment, is to try to figure out, because it helps with treatment planning, right? We want to
Yeah.
make sure that they're getting the right intervention, to address the needs. So, but it
Yeah.
is hard.
Wow. Well, thank you for, kind of going deep diving on that for us because you gave some really good signs of both and signs of how they could be together and how they could be separate. So I like parents, I think will very much appreciate that.
Good. I'm glad.
Yeah.
I know. I hope I'm not confusing parents more,
No,
but
I don't
there
think
are
so.
some clear indications that, it is one or the other. It's when
Right.
you notice both that you may have, yes, this comorbidity for you or your child.
Right. Absolutely. Yeah. What I'm curious about is let's say we've understood we have this comorbidity and how would that affect a child's life differently than just having one of those things, which I think you've kind of touched on, but if we want to go a little deeper.
Yeah, of course. I do think kind of the biggest barrier, or the additional challenge, I guess we'll say, is if, your child has ADHD and dyslexia, is trying to get a good understanding of how the attention deficits can really impact a child's ability to participate in the reading intervention.
Mm,
Um, so, the in terms of course, treatment for dyslexia, or intervention for dyslexia, reading intervention, using the Orton-Gillingham method is, what is recommended.
yeah.
However, if you think about how ADHD works, so, I know I've mentioned the trouble participating in non-preferred tasks.
Right.
So someone with ADHD, they do have a very, very hard time being able to engage in something that is non-preferred. And it's not just about what they are interested in and what they're not, but it's also a task that that child feels like will require a lot of effort, a lot of sustained effort,
Mm,
that might be more tedious or more difficult. And someone with ADHD and dyslexia, well, reading is one of those
oh yeah.
activities that is more difficult. Um, so having ADHD does put up an extra barrier,
Okay.
almost getting the child's buy-in
Right.
to want to participate. And I will say want may not be the right word, because I think all of those children do want to be readers.
Absolutely.
And
Yeah.
that's want is not the right word, but um, the motivation is there, to want to be able to read,
Hmm.
but getting over that hurdle of understanding that it's going to be hard. It's going to
Yeah.
be very hard. And it truly is difficult for a child with ADHD to do something like that
Yeah.
without a lot of, kind of motivation or reward. It's something that can make it more difficult, to do the reading intervention. It's not that it's impossible, but it just makes it a
Right.
little more difficult. And a lot of that, of course, is related to focus. So if the ADHD is not being treated, then of course they have a hard time focusing, and that will limit the amount of information from those, reading sessions that they will be able to really attend to,
Right.
store in their memory, and then be able to recall that information later. So it'll be less information that is getting stored, and then they
Yeah.
can less information that they can build upon in future, sessions of
Yeah.
the reading intervention. So there's actually some studies that kind of look at the difference between on and off task behaviors in the classroom for kids with ADHD versus, kids that don't have an attention deficit.
Right.
The kids without an attention deficit tend to be on task, kind of around 80% of the time.
Okay.
But kids with attention deficits are on task around 40% of the time. So
Wow.
when you think about that, even in a one-on-one or a small group tutoring session, it is a lot more challenging for those kids to be able to participate for the entire hour or 45 minutes.
Right.
They're taking in maybe half of that information. I
Wow.
know it. So, something I usually go over with parents is that in terms of the reading intervention, with ADHD combined, it may be a process that is longer. It
Yeah.
may take more time,
Right.
to make the progress that the child is capable of making, but it
Absolutely.
take more time to do that. I think the other, impact to kids with both kids with ADHD and dyslexia, they are both more at risk of having an emotional impact. So
Okay.
developing anxiety, depression,
Yeah.
low self-esteem. When you think about a child that has both, they are just dealing with more challenges. And so,
Yeah.
that it is a greater risk of having some sort of, impact on their mood or overall anxiety.
Right.
And a child with ADHD and dyslexia, they may get more easily frustrated as well. And, since they have, when they're trying to read or write,
Right.
and since they have some trouble with, regulating impulses and behaviors, this may be the child that you see with their frustration as it grows, that they do have more emotional outbursts. There may be
Yeah.
more tears or yelling and frustration, when they're
Yeah.
trying to do these tasks. So, there is also a greater chance of them becoming, more down on themselves, more negative self talk that they're engaging
Right.
in, and just feeling anxious because they can't
Yeah.
do the same things that their peers can do. They have a hard time focusing. And so, not only is the reading instruction hard, but then they realize they've been tuned out and they've missed part of the instruction. And now they're
Right.
even more behind. And that causes more anxiety,
Oof.
trying to, pick up and figure out where they are in the instruction. And so
Right.
there is a greater risk of having that impact. So, it is something that it does create some additional challenges for kids
Yeah.
that have both.
Yeah. Definitely. And you had mentioned like ways to treat the two, like kind of briefly, right? And so since they are very different things, do you recommend that they're treated separately or like you said with like the reading intervention, which we do here, we might have to there might be more repetition of things, right? Like you might have to do things a little bit longer. So do you recommend that they're treated separately together or like is there some kind of magical combination of approaches?
Wouldn't that be nice?
Right.
um, Pull out a magic wand and you can just, solve the problem.
Absolutely.
Um, yeah. No, when I'm meeting with parents to go over, kind of results from an evaluation and, thinking about the treatment plan, of course, a lot of it depends on the child and, kind of the severity level of both conditions. But I will say overall, I am recommending both being treated together. So
Okay.
treated simultaneously, because of what I mentioned about how the attention deficits really interfere with a child's ability to engage in the reading intervention. So,
Yeah.
I'll go over with parents all the options, with ADHD as far as treatment. Stimulant medications are, medication management is,
Yeah.
the number one recommendation as far as treatment. And there's stimulants and non-stimulants. So there's different
Okay.
options in terms of the types of medications.
Right.
And that's something that I always recommend parents, get a little more information from either their pediatrician or they can meet with a child psychiatrist to go over those
Okay.
options. Because there's usually some concern about, their child taking a medication like that,
Yeah.
which is understandable.
Right.
But the medications themselves are really, really effective, which is why they're the number one,
Yeah.
recommended treatment. And it's also something, kind of a big concern that parents usually have is that, it will have some sort of lasting impact on development. Stimulant medications have a very short half-life. So all that
Yeah.
really means is they're out of your system very quickly. So,
Right.
they last for, depending on the type of medication, kind of 8 to 12 hours, and then it's
Mhm.
gone. And it is something that is very, very helpful in terms of their focus and their ability to really just attend with detail and take in the information.
Right.
So it's definitely worth the conversation, with a medical provider for any parents that are kind of on the fence.
Right.
But medication management is recommended.
Yeah.
There's also with ADHD, so the medication, of course, is designed to improve that attention span, but other challenges with executive functions. So the forgetfulness and, misplacing items and, being able to plan and manage your
Yeah.
schedule and time, you need help learning those
Yeah.
skills. So, medication's not the only answer. Something that's really helpful is to work with an executive function coach or a
Okay.
therapist, that can help build those executive functioning skills. And depending on the age of the child, a lot of times coaches will also work directly with parents. So
Mm.
for younger kids, they're doing more parent coaching to help
Right.
build some of those strategies. As kids get older, and that kind of middle school, high school age, that's when, a coach would work more directly with the child versus just the parent.
Right.
They'll do a lot of help, a lot of work with parents to help build those executive function skills.
Okay.
So I would recommend that ADHD be treated. And then, of course, I recommend the reading intervention for dyslexia.
Right.
The only other thing to consider, just depending on the impact that on a child's mood, or anxiety, is parents could also consider therapy, psychotherapy. So,
Okay.
if they did take that avenue, they could work with a therapist that is, more trained to treat a child with ADHD. So they could
Hmm.
also help build those executive function skills. They wouldn't
Okay.
necessarily need to work with a coach at that point.
Right.
But if those mood concerns were not there, then, they could go with the executive function coach route.
Okay.
But yes, I would recommend them both being treated together.
Yeah. Okay. And this is kind of like a technical question, but it just popped into my head of kids have long days, especially in this area. The Northern Virginia area
Yeah.
is very, um, we have got a lot of go-getters here. Everyone's trying to do everything all at once.
Yes.
So do you recommend for those kiddos that they have shorter sessions of each thing if they can't do them in one longer session, right? Like we have the ability here to help kids with executive function if they need it, right? And so it could be worked into a session. But if you are seeing a reading specialist or, executive function coach who can't do both things at the same time, would you recommend shorter sessions? Or do you think, like, what do you think?
So for a child with any sort of attention deficits as well, I do think shorter sessions are better.
Okay.
Just across the board. You're more likely to, sustain that attention for
Yeah.
more of the time. If you notice big changes, let's say with ADHD treatment, with medication and their focus, I mean, that's the goal, is to notice those
Right.
changes. But if you see that they can sustain for longer periods of time, you can definitely do a longer session. But overall, I would recommend a shorter time,
Okay.
would be better. And then, as you all can kind of decide, of course, as the reading specialist, as those skills build, if
Right.
they seem like they can, kind of sustain a little bit longer. But I think shorter would be better for sure.
Yeah. Because I was just thinking, if you've got that long day, but you need to work on both of those skills, if you can't put them in together in one thing, do you, need to make the day a little shorter?
I know that it's a long day. The kids are usually also, they're already tired, like you said.
Yeah.
So yeah, I would do something shorter. It would be great if they can get that reading intervention, done during the school day. And I know that
Right.
you all do some of that,
Yeah, for sure.
kind of depending. So if it can be combined, that's the ideal scenario.
Right.
But yeah, for those after school sessions, someone with ADHD, they probably do need it to be a little bit.
Yeah, absolutely. Yeah, the middle of the day sessions or like morning, something during the school day, we always do encourage because like you said, at the end of the day, asleep, these kids.
Yeah.
They want to be, they want to be playing, they want to be running around
Yeah, as they should be.
as they
And,
should
I
be.
know I'm talking about a lot of treatment, but you bring up a great point. You do need to balance that. They need time to be kids. So,
Yeah,
that's where, working with someone like myself, someone like, all of the specialists at our LLC, coming up with a plan that, not only is going to improve their reading skills and,
yeah,
kind of the academic performance, but also a plan that still gives them time to be a kid, to play, to
yeah,
nurture their social relationships, but also to be able to do things where they do feel good about themselves. So,
yeah,
those after school sports or clubs activities where they feel confident and capable, those are things that also need to continue, because you
yeah,
want a child to have an area where they feel like, they're good at something, where they feel like they
yeah,
are doing something, that they are strong in and is worthwhile and makes them feel good about themselves. So,
right.
it is all a balance, for sure.
Absolutely. Yeah.
Mhm.
Thank you for saying that.
Yeah, of course.
Okay, so we talked about lots and lots and lots of good things, but I wanted to kind of get to the root of like how this comorbidity is diagnosed. So, do children normally get both of these diagnoses at the same time, or is like just one come and then they notice another? Like, I don't know. You've got all the details here, so tell us.
um, Here's my favorite answer. It depends. Um,
Of course, of course.
So it hopefully, if again, you're coming for something like a psychological assessment, majority of the time we are able to determine what is the underlying cause. So if a child does have ADHD, dyslexia, or both. What I will say, the reason for my it depends answer, is that it largely depends on what is being presented, on how the
Okay.
child is, I would say, behaving, or what their main struggles are. So a lot of times, and I'm focusing on the classroom, but this is at home as well.
Right.
A lot of times when a child has both conditions with ADHD, some of the, behavioral challenges can be more prominent. Um,
Okay.
so, for kids that are more hyperactive or impulsive, those are more easily observed, by
Right.
parents and teachers. And so that can be something that is recommended to be assessed first.
Right.
So, if those behavior challenges are more significant, or if attention deficits are also pretty significant. So, attention is tricky because it can be unnoticed,
Yeah.
and attention can be unnoticed for sure, especially if a child is able to regulate, their impulses. They don't have that hyperactivity, impulsivity.
Right.
Some attention can go unnoticed in the classroom. But if those, inattention challenges, again, are more global and more severe, so parents notice very frequently that their child is, forgetting the one or two things that they've asked them to do. They can't remember where anything is in the house.
Right.
And teachers notice that they're very easily distracted or off task, and they need a lot of one-on-one
Mm.
instruction to make sure that they stay on task or they're able to kind of follow along. Then, I think the ADHD is more likely to get noticed earlier
Yeah.
than any sort of reading challenges. Because the other side of it is let's those early elementary years, kindergarten through second grade, let's say, kids are still learning the foundational reading skills. And so
Absolutely.
a lot of times it is this mentality of let's wait and see.
Right.
In the classroom, teachers will kind of give parents that feedback of, well, let's wait and see. All kids come into kindergarten with different levels of knowledge and skills
Yeah.
related to identifying their letters or even being able to read words. And so
Right.
until they have had that reading instruction, that is more structured and direct, like in the classroom, it's
Right.
difficult to determine if this is just, they haven't had the exposure
Mm.
or the instruction, or if we're looking at an underlying, reading issue as well. So,
Right.
for kids that are younger, a lot of times the concern when they come to see me will be related to attention,
Okay.
and the behavior, unless the challenges with reading are very severe. So
Okay.
let's say first grade, they still can't identify letters, then that is apparent, that there is likely another issue. But hopefully parents will come and, to a practice like ours and get that comprehensive assessment, to be able to then just evaluate, like I said, kind of where they fall in terms of their performance, because, you know, we are looking at data. So all of the assessments we use are nationally normed,
Right.
evidence-based, assessments. We're seeing how, for the child's age, their education level, how their performance kind of compares to what would be typical development.
Right.
That way we can determine, what that root cause is of these learning challenges.
Yeah.
Without that, though, I think it can be difficult, and it just depends on what is more apparent
Yeah.
in the classroom and at home.
Okay. Yeah. So it sounds like if a kid comes to you like a little further into elementary school, maybe like third or above, it's easier to kind of get the diagnosis of both of them at the same time because at that point, schools are expecting kids to read for comprehension, right? That's kind of my understanding of that.
Yes. Yeah.
Okay.
They can definitely get the diagnosis before third
Right.
grade, but I think that's where parents may come into our office with one concern, and then they realize, when we're finished, that there is an additional concern,
Gotcha.
that they may have been aware that, let's say, their child was a little bit delayed as far as their reading skill development, but they
Hmm.
may not recognize that, this is also tied to, their phonological awareness.
Right.
And it's not just something where they can't focus on the words on the page, and that's
Okay.
why they're making mistakes. So you can definitely get a diagnosis of ADHD and dyslexia prior to third grade.
Okay.
But I think in the classroom, I think the referrals for those older kids, unless the dyslexia is severe, it
Hmm.
may not get noticed, yes, until the reading shifts from learning
Gotcha.
to read to, reading to understand. And that is
Right.
where that shift happens, is around third grade.
Okay, that makes sense. I think that was my last question for you. I don't know if you
Okay.
have anything you wanted to like add.
I don't think there's anything I wanted to add. I mean, I hope that I've been clear and answered all of
Oh
your
yeah,
questions. I know I've kind of talked throughout about the benefits of getting a psychological assessment, but
yeah,
I will reiterate that is that, you
absolutely.
know, we are here to help you, as parents understand, where some of these learning challenges lie. Also understanding where, your child's strengths are and how to use those to help with
Yeah,
learning. But the goal is taking all that data to then come up with a treatment plan, come
yeah,
up with a roadmap to understanding how to help your child be as successful as they can be. Because that's all parents want. That's
right.
all is, our kids to be happy and, to live up to their potential. And, when they do have some of these roadblocks in the way, it is definitely hard to see as a parent and can be very confusing to know how to help. And so that's why we're here. We are here to help you, figure out what's going on and where to go from here. So yes, can feel overwhelming for
Yeah.
sure, but there are answers, there are treatments. So, we are just available to help as you need.
Awesome. Well, yeah, like I said, I'll
Mhm.
make sure to put all of your info in the show notes so folks can come see you.
Wonderful.
Yeah. Well, thank you so much for being here. This has been fantastic.
Thank you. Thank you again for having me. This has been great.
Thank you so much to the audience for listening. Make sure to subscribe and leave us a little rating and review. It helps other folks find the podcast, and we'll chat with you next time.